guys, this is Dr. Hub. Today we'll look at the levels of prevention. So under the levels of prevention, first we have the phase of diseases. So we look at the primordial. So under the primordial, what is a phase of disease? So it is an underlying socio-economic and also the environmental conditions which lead to the causation. It leads to the causation. And what is the aim of this? The aim of the primordial will be to establish. So there is the establishment as well as the maintaining the conditions. So establish and maintain the conditions, and it minimizes the hazard to health, and it minimizes hazard to health. Now let's look at the actions. So under actions, it includes there is inhibition of the emergence, and this is going to be of the socio-economic. It is of the socio-economic, as well as there is the environmental and the behavioral conditions. Next we will look at the modes of innervation, that is shortly known as the MOI. So modes of innervation will be by the health education. So what is the target of the primordial? So whom are we targeting here? It will be the total population. It is going to be the total population or the select groups. So it's going to be the total population or the selected groups. Now we'll move on to that of the primary. So what is happening in case of the primary? So in the primary, the phase of disease involved here, it is specific, it is causal or the risk factors. So what is the aim here? The aim here is basically to reduce. So there's decrease in the incidence of disease. There's reduce in the incidence of disease. And what are the actions? The actions would be by protection of personal and community health. There's protection. This is of the personal as well as the community health by eliminating risk. So you eliminate the risk. So what are the modes of innovation? The modes of innovation, it includes the health promotion as well as the specific protection. So who are the targets in terms of primary? So let's look at the targets. So in terms of targets of primary, it includes the total population, similar to that of the primordial. So it's a total population and or the high risk individuals. There is a high risk individuals or the groups, high risk individual or the groups. Now let's look at the secondary. So in terms of the secondary, what is a phase of disease? It is in terms of the early stage. So it is early stage of the disease. So what is the aim? The aim is to reduce the prevalence. So you reduce the prevalence, and this is by the shortening duration. So how is the actions? The actions, if you see, it will be the early detection. So you do an early detection and also the intervention to minimize disability. So innovation to minimize disability. So now let's look at the modes of innovating. So the modes of innovation, it is by diagnosing and treating. This is very important. So diagnosing and treating is seen in secondary. So diagnosing and treatment. Then what are the targets? The target would be by the individuals and patients. So individuals or the patients. So let's look at tertiary. So under tertiary, what is the phase of disease? The phase of disease here is it is late stage of disease. So what is the aim? The aim here is to reduce the so reduce the number as well as the impact. So reduce the number and the impact of the complications. And what will be the action? The action is by you soften the impact of long-term disease. So you soften the impact, and this is going to be of the long-term disease and disability, and you minimize the suffering. You minimize suffering. Next is we will look at the modes of innovating. So modes of innovation is by there is a disability limitation. You have a disability limitation and also the rehabilitation. So then we look at the targets. The target here is nothing but the patients. So this was all about the levels of prevention. We saw the primordial, primary, secondary as well as the tertiary, and we saw them in respective headings such as the phase of the disease, aim, actions, innovation and the targets. So to learn and grow daily like this, please do subscribe.